Princess Yasmin Aga Khan, President of the Alzheimer's Disease International, Mr. Glenn Rees, Chairman of ADI, Ms. Paola Barbarino, CEO ADI, ladies and gentlemen, good afternoon, and thank you for inviting me to the ADI Virtual International Conference 2020. In normal times, I would be welcoming all of you to our sunny island, a melting pot of rich and colorful cultures and a global intersection between East and West. But as the world faces unprecedented challenges brought about by the COVID-19 pandemic, we have to take this conference into the virtual space. The world may have changed, but the work we must do to serve the needs of persons living with dementia and their caregivers remains the same. Indeed, the dementia community needs us more than ever during such challenging times. Efforts to reduce the virus's spread have led to increased social isolation and loneliness, as our elderly, including those living with dementia, are unable to interact with others in the community as much as they used to. The changes may also lead to heightened stress levels among caregivers and family members who have to comply with safe distancing measures even as they continue to care for those living with dementia. We must collectively take steps to mitigate the effects of the pandemic on those with dementia and on their caregivers. Not-for-profit dementia organizations also need to be more careful in managing their resources during this period. Thankfully, many community care providers have risen to the challenge and continue to support persons living with dementia and their caregivers during the pandemic. For example, the Alzheimer's Disease Association and the Agency for Integrated Care work together on the SPOC-19 initiative to support families who may have concerns regarding their loved ones unintentionally breaking the circuit breaker rules due to dementia. Even before the pandemic, dementia was an issue that warranted attention, being one of the major causes of disability and dependency among elderly around the world. According to the World Health Organization, there are over 50 million people estimated to be living with dementia around the world. This number is set to reach 152 million in 2050. Adequate support must thus be in place to ensure that their quality of life is not adversely impacted. The global dementia community must also rally to discover new science, new knowledge, and new solutions. In Singapore, it is estimated that 1 in 10 seniors aged 60 and above has dementia. The prevalence increases to about 1 in 2 seniors aged 85 and above. As such, Singapore is working to build a dementia-inclusive society where everyone has the right to live with dignity and no one is left behind. We want to reduce stigma by increasing the awareness and understanding of dementia. This will enable persons with dementia to integrate and be accepted in our community, where they can lead purposeful and meaningful lives. Since 2012, Singapore's Ministry of Health has been strengthening mental health care, including dementia care, under the Community Mental Health Master Plan. Besides increasing services and resources, the ministry works closely with community partners like the ADA to reach out to those living with dementia and their caregivers through public education programs. The dementia-friendly community is another key initiative where community members, such as residents, business owners, and grassroots leaders learn more about dementia, and resources are made available in the community to support persons with dementia and their caregivers. In DFCs, community partners such as elder care centers and businesses will form a network of go-to points, which serve as safe return points for persons with dementia and where arrangements will be made to reunite the persons with their families. To date, we have established 10 DFCs in Singapore. Even though the COVID-19 situation has disrupted many of the DFC's activities, we hope that the situation improves. The DFCs will be able to resume efforts to galvanize community support for persons with dementia and their caregivers. The ADI International Conference can play a key role in empowering the global dementia community through its unique multidisciplinary format. Over the next few days, experts will share their insights on the action areas of the WHO's Global Action Plan on Dementia, while other sessions, workshops, and symposiums ensure that there are ample learning and networking opportunities for all delegates. Dementia is not a battle to be fought alone. It heartens me to know that all of you, researchers, scientists, clinicians, allied healthcare professionals, care professionals, and volunteers work together with people living with dementia, their family members, and their caregivers. This inclusiveness is proof that the global dementia community has made great strides forward. And when the world pulls along towards a common goal, there are no limits to what we can achieve together. I wish everyone a fruitful conference. Thank you.